The number of COVID-19 cases is also surging internationally. But unlike the U.S. and other wealthier nations, vaccines are still in very short supply in most countries. Elizabeth Palmer reports.
Good morning. Health workers have now injected more than 4 billion doses of the coronavirus vaccine into arms worldwide. And yet, that's just about a third of the minimum that's going to be needed to bring this pandemic under control. Southeast Asia is still a hotspot. In Bangkok, monks came to get their shots after authorities saw COVID spreading in crowded temples. Meanwhile, refrigerated containers are back in service to store the dead. The first time they've been needed since Thailand's tsunami in 2004. In the south of neighboring Myanmar, medical staff had to evacuate patients from a flooded hospital. After a recent coup, public health systems are collapsing, and experts say fully half the country could be infected in the next 2 weeks. Even ground zero of this virus, China, which had controlled it early on, is facing a fresh outbreak in the city of Nanjing that's already spread to other cities. So far, more than 80% of the vaccine doses worldwide have gone to higher-income countries, though donations are at last starting to flow to the global south, notably Africa, where COVID deaths are up 80% in a month. In Nigeria, 4 million doses donated by the United States have now landed. And Tanzania's new president, who replaces a vaccine denier, got her shot on TV and urged people to do the same with a shipment of newly arrived Johnson & Johnson vaccine. Haiti, too, in chaos and suffering a serious COVID outbreak, finally received 500,000 doses from the United States. But until mid-July, it had been the only country in the Americas to have had none at all. The World Health Organization warns that as long as this vaccine inequity persists, this will be a two-track pandemic. And many of the world's poorest people will not even be offered their first shot until sometime in 2023. John?
Elizabeth Palmer in London.